In the heart of Nigeria's largest city, Lagos, otherwise dubbed megacity, a silent crisis unfolds. Every year, hundreds of women and girls, if not thousands, face life-threatening consequences from unsafe abortions. This investigation, by Juliana uncovers the hidden realities behind the statistics. Behind every statistic is a woman's story. We spoke with families of women who died due to unsafe abortion and survivors who shared the pain, stigma, and fear they endured. Many described unsafe procedures carried out in unregulated facilities, often leading to severe complications. Listen as Amaka shares the heartbreaking story of losing her young sister. I lost my sister through abortion. It has been about 10 years now, and it was a painful experience. My sister was 22 years old at the time. She was my immediate younger sister, and we were very close, so close that people often thought we were just friends. She was the fairest in our family. On the day it happened, I was working as a makeup artist on a Nollywood set in Ikorodu. Normally, she accompanied me everywhere, but that day, she stayed home. I called her to assist me, and she sent me a video showing herself on a drip, saying she wasn't feeling well. I thought it was malaria and told her to rest. The next morning, my other sister called to ask if I knew that she had undergone an abortion. I was shocked. She had hidden it from us. The nurse administered antibiotics without conducting any tests. Later, my older sister discovered a bucket filled with blood-stained clothes in her room. When confronted, she admitted to having an abortion. We rushed her to a private hospital where they performed an evacuation and found the baby's hand still inside. Her condition worsened and she was referred to a general hospital, then eventually to LUTH. At LUTH, the doctors requested 350,000 naira before moving her to the ICU. We managed to raise 200,000, but they refused to act until the full amount was paid. Eventually, they began moving her, but there was no electricity to operate the lift. While I ran to find someone to fix the generator, she began gasping for air. She held my hand tightly, apologized repeatedly, and then passed away right there. Breaking the news to my father was another tragedy. He believed she was being treated for malaria. When the truth was revealed, he collapsed and never recovered. My mother has also struggled ever since, suffering from high blood pressure and a partial stroke. We found messages with a nurse who had performed abortions before. It was clear she was a quack. Sometimes I think she could have just kept the baby and lived. Seeing her friend's child grow up makes me wonder. I believe if abortion were legalized, my sister would still be alive. Stigma and fear force women into unsafe procedures. Legalization would save lives. Avoidable deaths, like what happened to Amaka's sister, continue to occur. In Lagos State, restrictive laws push many women toward unsafe procedures. Unsafe abortions are criminalized under the Criminal Code Act. Sections 228 and 229 penalize unlawful abortions with up to 14 years in prison. Section 230 states that supplying drugs or instruments for unlawful abortion carries a 3-year prison sentence. Lagos state laws generally mirror these federal laws. The WHO explains, an abortion is unsafe when it is carried out by a person lacking the necessary skills or in an environment that does not conform to medical standards. The Lagos State Guidelines on Safe Termination, the STOP Guidelines, were launched in 2022 but suspended following opposition from religious bodies. The Lagos State Police Command recorded 67 reported cases between 2020 and 2025. 28 individuals have been charged, but data on deaths remains unclear. According to the WHO, 25 million unsafe abortions occurred every year between 2010 and 2014, with 97% occurring in developing countries. SOGON reports that unsafe abortions are responsible for about 13 out of every 100 maternal deaths in Lagos State. This is a staggering reality. Medical professionals warn that unsafe abortion is not only a health issue but a social justice crisis. Experts argue for expanding reproductive health services. In Nigeria, viability is defined as 28 weeks. Abortion becomes unsafe when performed by unqualified personnel or in substandard facilities. It remains illegal except when the pregnancy poses serious health risks to the mother or when the fetus has severe anomalies incompatible with life. Complications can be immediate, like bleeding and infections, or late, like infertility and psychological problems. These are dire emergencies. Solutions include training medical personnel, equipping health centers, and expanding access to family planning. Abstinence and education are also key. Dasola Tevogbad, a feminist activist, says her abortion story began in 2018. It was traumatic not just because of the procedure, but the stigma. At OUCHC, medical practitioners treated me with disdain. One male doctor refused me a bed, even as I was close to passing out. His cruelty was sadistic. No anesthesia was used. He mocked me, forced me to look at the suction, and demanded religious confessions. It was absolute horror. In 2019, I went to a private clinic. Even though I paid for anesthesia, the doctor withheld it. Later, a different doctor refused to provide contraceptives. In 2022, a condom burst and emergency pills failed. Fake pills were circulating. I publicly announced my abortion to dare the authorities to arrest me. In France, I can openly discuss this. The Nigerian government fails to prevent unplanned pregnancies, yet it criminalizes healthcare. Women should have rights. What drives unsafe abortion? First, a restrictive legal framework. Second, a policy gap. Nigeria signed the Maputo Protocol but hasn't given it full legal force. Cultural and religious stigma complicate access. Hypocrisy plays a role. Those who oppose it publicly may seek services privately when affected. Costs are prohibitive. Vulnerable groups cannot afford private care. Many turn to patent medicine vendors or unsafe home remedies like herbal concoctions. Nigeria can learn from others. South Africa liberalized laws, reducing mortality. Nepal implemented safe services even in rural areas. Reform is possible. The suspension of stop guidelines violates the right to life provisions in international conventions and the Maputo Protocol. It's a violation of basic human rights. Human rights lawyers can seek litigation based on the dignity of the person. The surest safeguard is reform and establishing social support systems. There are no legitimate over-the-counter medications for abortion. Substances used are often unapproved, unsafe, and designed for different purposes. Access through illicit channels poses serious dangers. Responsibility is essential. Use protection and avoid tragic outcomes that place families in mourning. A survey at Lagos Island Maternity Hospital found that 21% of patients were teenagers. Many single women obtained abortions late, above 12 weeks. Medical doctors were the abortionists in 46.9% of cases. Sepsis was the commonest cause of death. These fatalities are preventable tragedies. Achieving SDG 3 requires systemic improvements in post-abortion care and universal access to comprehensive sexual and reproductive health services. Unsafe abortion is a preventable tragedy. The question remains, how many more women must suffer or die before these issues receive the urgent attention they deserve? This report was facilitated by Women Advocates Research and Documentation Centre, WARDC, under the Normalising Safe Abortion (NSA) project with support from the Reproductive and Economic Safety (RAES). The investigation was carried out by Juliana Francis.